Okay, so pendulum exercise. Now I prescribe this to pretty much all of my impingement shoulder patients and pretty much to most of my shoulder patients. It's a really useful exercise at creating a bit of traction through the shoulder joint. So I'm going to use a bottle of water here just to add a little bit of weight to my arm like that. So as I move my body, my arm should follow the movement, hence why it's called the pendulum exercise. So the incorrect way to do this would be to engage the arm and then move like that. Because if you're creating movement through your shoulder muscles, then the shoulder is not relaxed and then it won't create any traction through the shoulder joint. So you really have to make sure that the arm is relaxed as much as possible, like that. And then as you move your body, the arm should follow the movements like that. So you can go back and forth, you can go side to side, you can do clockwise movements or anti-clockwise movements. It doesn't really matter, make the movements as random as possible. It may take a few weeks just to get used to relaxing those muscle fibres because it is a bit of a skill in itself. A lot of patients that I show it initially, the first few days, maybe up to a week, they have a little bit of an issue with actually relaxing the shoulders. So if this is you, don't worry, it's completely normal. What I say to patients with this issue is just to let the arm hang free, really relax it, and then test it with your other hand, like that, and then just push it away. If it's relaxed, it should sort of naturally swing on its own. If it's tense, you won't be able to push it, or when you do push it, it's quite unnatural and you're sort of moving it that way. So with that, give that a go for around 2 minutes a day if you can. More the merrier on that exercise. There's no real sort of time frame or time limit that you sort of need to adhere to, but it's quite a simple exercise, so the more you can do it, the better.